Well, good morning, everyone. Welcome to the June 24th session of Buckeye Scope, Supporting Children of the Opioid Epidemic. As you were already doing, as you came on, go ahead and rename yourselves to your first, last name, and organization, if at all possible. And then put into the chat box the same information for attendance purposes. That gets recorded for us, and it makes it so much easier later. As you just heard, we have captioning available. And I'm going to double check to see if we have anyone joining us by phone today, and it doesn't look like it. So we will go ahead and move forward. So as a reminder for ECHO, we have our hub team, and you'll see us marked by the asterisks before our name, as well as the project scope backgrounds. So Andrea is not able to be here today. I'm Steph Weber, licensed psychologist in Cincinnati at Children's Hospital. We have Elsie Bush, who's here as an occupational therapy representative. Michelle Riley-Roberts, who's also a psychologist and specialist in trauma. John Kinsel's unable to join us today, but we also have Kristen Kerwin, Stacy Lee, and Sue Meeks as nurse navigators in our Athens County area through Ohio University. We have Aaliyah Keeley and Troy Hunter, who are developmental specialists with Ohio State University Nisanger Center. Amber Clark, who is a licensed social worker at a therapeutic interagency preschool at Cincinnati Children's. Dr. Leslie Razorbecker is not able to join us today either, but we have Dr. Kathy Wettig and Dr. Pam Williams. Dr. Wettig is a neonatologist, recently retired, but still very much involved in the Cincinnati area. And Dr. Pam Williams is a developmental behavioral pediatrician at Cincinnati Children's. And then Michelle Hendricks is our adoptive mom and advocate who's unable to join us today. And then we also have Joe Mayo, a peer support recovery specialist from Marietta Memorial Hospital. So if you have any questions throughout today or the series, don't hesitate to reach out to any of us via chat or during the breakout groups. You'll see here in our series, we already finished session 1, the opioid crisis, social determinants of health and addiction and treatment. And so the recording is available on our Canvas site. You'll be able to get access to all that information in the emails that Jesse has sent you. And again, please always make sure to complete your evaluations. That's very important to us. We go through them every week to make sure that we're responsive to the feedback that we receive. Today we have peer support with Dr. Emily Kaufman and Evan Rooney. We're really excited about this new session in this Buckeye Scope series. And then next week we have toxic, I'm sorry, not next week, 2 weeks, we'll have toxic neurodevelopment with Dr. Kathy Wettig. And then you can see so on and so forth. We've also added in a session on fetal alcohol spectrum disorder in mid-July. And then we move on through all the way to our last session is October 15th. Today's agenda, we're going to finish our inductions and we'll move into the didactic series on peer support. We'll have some clarifying questions, and then we have a challenge or opportunity presentation that closely aligns with the presentation today. We'll move into our break rooms, and we heard from many of you that you wanted more time in breakout rooms, so we've tried to make sure that will happen, and I will stay on time so we can do that. And then we will come back for some more time for our whole group discussion so we can learn from each other. We have Dr. Emily Kaufman, who's an associate clinical professor at The Ohio State University Wexner Medical Center, working for both the hospital medicine division and the emergency medicine division. She is board certified in both internal medicine and emergency medicine, and completed her dual residency training at Louisiana State University, New Orleans. She received a master's in public health from Ohio State and has academic interests in infectious disease, community health, and interventions regarding the current opioid crisis. She has served as a PI on statewide funded grant coordination with Franklin County Public Health to implement medication-assisted treatment in the emergency room with OSU East as one of the 3 sites in Ohio. She is also involved with several other opioid-related grants and committees to ensure seamless care for patients with opioid use disorder. Due to her above work, she was recently awarded the 2020 Emergency Room Physician of the Year by the Ohio chapter of the American College of Emergency Physicians. Fantastic. And then joining her today is Evan Rooney. And Evan Rooney is from Columbus, Ohio, and has worked as a certified peer recovery supporter for 2 years, and most recently as a chemical dependency counselor assistant. Evan is in recovery since August 2016 from a previous 6-year heroin and crack cocaine addiction. In his spare time, Evan enjoys spending time with his husband, Terry, and their 4 dogs, Willie, Gracie, Gemma, and Bentley. And Evan currently works at Primary One Health in Columbus as a behavioral health outreach specialist. So we are very excited to have this new session, and I will turn it over to you, Dr. Kaufman.
Great. Thanks very much for having me. Appreciate being here. I love working with multidisciplinary, interdisciplinary audiences. So my time here is going to be brief because I really want to make sure that Evan Rooney, he has a lot of great content to share with you all. So let's go ahead and get started. We'll get through this as quick as we can. Next slide, please. So this is our title. We're combating the opioid epidemic through the use of novel approaches such as peer support, healing through the shared experience model. Next slide. And I have no disclosures. Evan doesn't have any disclosures. Next slide, please. These are learning objectives. I believe you received these in advance, so I'm not going to spend much time going over these, but essentially we'll be learning about the utility and importance of integrating peer support coaches, peer support staff into multiple disciplinary settings. I'm most familiar with these in the emergency room and in next slide. Thank you. So I hate to start off with bad news, and I actually have a coffee mug that sort of simulates this, that basically 2020 was a 1-star year. We all know it was a terrible year. Unfortunately, there's new data out showing that we have surpassed 90,000 deaths in the United States due to all overdoses. Unfortunately, the majority of those are related to fentanyl, which we struggle with immensely here in Franklin County. And that's close to a 30% increase from 2019. In Ohio, we're about to set all-time records in a bad way as well. We're over 5,000 deaths, again, a 20% increase from 2019. And that's about 14 people dying every single day. May was actually a record month. I don't think they finalized the numbers, but we anticipate to have about 600 people that died in the state of Ohio due to overdoses. And to kind of give you a sense of those numbers, here in Franklin County, where we are probably the most populous county in the state with the highest overdose death rate, we are about 800 deaths for the year. And in 2020, we had about a little over 1,000 people who died from COVID-19. It's anticipated if we're on this current track that we've been on, we will well exceed deaths due to COVID in the long run, and consider this epidemic has been going on close to 25 years. In the state of Ohio alone, from 2009 to 2018, we've lost over 1 million years of lives lost. And that's unconscionable. We've lost young people at the prime of their lives, work productivity. This is something that needs to stop. In the state of Ohio, prior to COVID, this was the 3rd leading cause of death. Next slide, please. So I like to remind everyone in all talks that I give various talks on various issues. It doesn't matter to me if you are a health professional, if you're a registration clerk, if you work in a convenience store. I want everyone to understand that addiction, all comers for addiction, that this is a chronic disease that is treatable. This is a chronic disease. This is not a moral choice. Somebody was not born like this, although genetic factors definitely have a significant contributory role. We think at least 50%, particularly when families, when we see cycles of addiction over and over. It's a very, very significant contributor, but this is a chronic disease. It's a horrible disease. We describe it as a hijacker that essentially takes hold of your brain, of your reward pathways. The hormone we look at is something called dopamine, but essentially, it may be that first time, whatever substance we think about, heroin, fentanyl, it could be methamphetamine, it could be crack cocaine, but essentially it's like a bomb goes off in your brain with what we call a euphoric response. So it's this intense sense of pleasure. And based on other wiring that you may have, genetic risk factors, your immediate environment, repeat use, your brain will get conditioned to only seek this substance over and over and over again at all cost. You will lose, connections to your family, to your friends, to your things that you love, your job. You will engage in risky behaviors to obtain that substance. And unfortunately, in many outcomes, it can be fatal. But the good news is that it is a chronic disease that is treatable. We have medications to treat it, particularly for opioid use disorder. And our recovery rates are just as good for that as they would be for any other chronic medical condition, such as diabetes, heart failure, or hypertension. We just don't think about it that way. We think about it as a moralistic choice. There's so much stigma surrounding addiction care. Next slide. And this is a brief video, and this gets into sort of my final topic, which is stigma. If you could go ahead and play that.
Words can become grenades, strategically spoken at times to do the most damage. And when those words come from family and friends, they cut deeper. Labels erased my humanity. Total strangers felt allowed to criticize or judge me, saying that I was just a drunk or addict. These words also carried the connotation that I was lazy, selfish, or a criminal. After a while, I began to believe the words, concluding I no longer served a purpose or deserved hope. Luckily for me, these feelings were eventually replaced with words that provided healing.
The research is clear. Not only do words shape how we view people, but words also shape how we treat them. For example, studies show that when someone is described as an abuser or addict, the general public and even clinicians are more likely to believe that they should receive punishment over treatment. Tragically, for those with addiction who are looking to lead fulfilling lives, hearing the terms drug abuse or addict is paralyzing and demotivating. It blames people for their own illness, ignoring environmental and genetic factors. It feeds into the stigma they experience from society, their family, and treatment providers. To help decrease stigma around language, the Office of National Drug Control Policy recommends using person-first language to replace judgmental and negative terms. For example, a person with a chronic medical illness that impacts their brain is not an abuser or an addict. They are John with a substance use disorder. John, a person who requires treatment and support to recover from his illness. Words matter. They can hurt and reduce someone's motivation.
Together, let's choose supportive, non-judgmental words that lead to treating people with respect and compassion.
Great. Next slide, please. This is my final slide. So that just essentially brings home the message in that previous video. Essentially, and this would apply to mental health. This certainly is not exclusive to just addiction care, but we try to portray person-first language. This is a person with a chronic disease. And so you will find these terms riddled throughout society, particularly in a healthcare setting. We have so much sort of pre-programmed language that we use. And you will hear patients themselves using this language as well and requiring re-education. So we talk about a person with a disease. We don't talk about clean and dirty, drug screens. We talk about people in recovery and treatment, and even relapse can be, to a certain degree, a bit of a misnomer as well. So these are really important terms, and this applies to everyone and anyone working with patients with addiction. So, and this is something we're working really hard on at the medical center currently. With that, I am going to turn it over to Evan Rooney, who I had the pleasure of working with at Ohio State. He was instrumental. He was our team lead for our peer support program. We started a contract with an organization called Thrive in 2019 when we started. So we provide peer support in our emergency department. We have always had a goal of aiming towards 24/7. We're close to it now, but he really led our program forward, and he's gone on to do bigger and better things. So with that, I'm going to turn it over to Evan Rooney. And next slide, please. Thank you.
Thanks, Dr. Kaufman. Obviously, thank you for allowing me to present with you. Thank you to Jesse and the entire Project Scope team for allowing me to be here as well. So as Steph, she introduced me, she kind of said a little bit of my background. I am a certified peer recovery supporter. So I did want to kind of explain, a lot of people aren't sure what peer recovery support is. So I wanted to explain basically kind of what it is in a general view, and then kind of go into a little more in depth regarding how it can support families and different programs that are here in Ohio that help with that. So a certified peer recovery supporter is someone who identifies as being in recovery, either from a behavioral health disorder or a substance use disorder, or both. They go through a certification process through Ohio Mental Health and Addiction Services. Once they are certified, their certification is there for 2 years. And then they do have to recertify, and they're required to do CEU training and stuff of that nature in order to continue their certification. Next slide, please. All right, so here's some core functions of peer recovery support. This obviously isn't the full list because the list could probably be 18 pages long, but I wanted to just kind of bullet point a few things. There's minimization to harm through self through recovery initiation. The recovery education and coaching for the individual, I feel, is the most important core function. As somebody who identifies in recovery, a lot of people feel, especially in early recovery or that they're trying to start their recovery journey, they feel they're alone. Having someone there to give them support, to let them know I've been, hey, I've been there. This is what's helped me get through whatever you may be struggling with. That goes a long way with people. To be honest, there's a lot of people that just want to have somebody there. They may not have family. They may not have any friends. They may have isolated themselves, which happens normally through addiction. I mean, I was basically to that point. I did have some family that still supported me through the whole thing. But there is some people who don't have anyone, and having a peer recovery supporter can help a lot. Obviously, there's recovery community linkage as well. There's places like 12-step meetings, healthcare, housing, food, clothing, childcare, transportation, and reentry programs. I know for me, when I was in early recovery, I struggled with navigating the service system. I wasn't sure where to start, where to even go in situations like that. And having a peer recovery supporter can be instrumental in that, because they can kind of help you navigate through those things and assist you to get linked with certain services in your community. Obviously, there's the sense of companionship and modeling of recovery lifestyles. So a lot of peers in early recovery definitely look up to their peer recovery supporter. They think of them as their role model sometimes. And the peer recovery supporter obviously does want to be that role model to show the peer that recovery is possible, especially long-term recovery. Some people feel like, I can only maintain 30 days of sobriety, and then, unfortunately, I always tend to relapse. So basically having somebody there that can say, hey, I've been able to achieve long-term sobriety, it can go a long way with people, because they do struggle with saying, I don't know if I can do it. Obviously, peer recovery supporters are good with recovery checkups. There's some peers that tend to, isolate themselves, not answer phone calls, not answer the door. The good thing is, since the peer recovery supporters hopefully built that relationship with that peer, if they may be in crisis, they are able to go visit the peer and help them to get whatever type of stabilization they need, whether it be hospitalization or anything of that nature. And then obviously the peer recovery supporter will teach the peers how to advocate for themselves and make sure that they feel like they're getting the treatment that they're needing. Next slide, please. Now, I want to talk about peer recovery support for families and how it relates. There is a program that started somewhat recently in Ohio, called the Ohio START program. It stands for Ohio Sobriety Treatment and Reducing Trauma Program. I'm sure a lot of you have heard of it. You can also get additional information on their website, ohiostart.org. It's also at the end of our presentation where the references are. But they do have something called family peer mentors. So basically, family peer mentors are required to have the following things. Basically, demonstrate long-term recovery from substance use or from mental health. They must have a GED. They must have their own lived experience with the child welfare system and a valid driver's license. some different roles and responsibilities of family peer mentors. They're really engaged in specific, children's services cases and stuff of that nature. And they always participate in the meetings, the weekly status meetings, and also family team meetings to make sure there is progress being made and the children are safe in certain situations. There's also exploration into the family needs in order to empower them as an actual family to take ownership over long-term successes and the safety of their children. There's also coordinating and providing assistance in crisis interventions, similar to what I discussed previously. And then also, the family peer mentors also can help identify barriers and, help the family as a whole to engage more in those community resources. Kind of examples of that would be maybe they don't have transportation. Maybe being able to link them with a company in their area that can do transport, or maybe even their insurance company, because some insurance companies do provide transportation, stuff of that nature. And then also, they provide input on, the building of the case plan and the children's safety plan to make sure that everybody is safe. Next slide, please. And then I wanted to talk about what youth peer support specialists are. They're specifically people who give peer support to youth. And basically what they do is they work with people who are transitioning into adulthood. And they're usually in the child serving system, such as children's services, things of that nature. They're close in age with the people that they work with. And they use their own lived experience with mental health, and also if there is substance use in there too, they can do that as well. And also, their experience in their child service systems that they went through to be able to relate to those people. They also help them to identify goals and advocate for themselves, which is similar to what I discussed in the previous slides. And there's just a few things, youth peer supporters assist youth with building hope, obviously with sharing their experience, letting them know kind of how they were able to basically recover and how they were able to navigate certain situations and things that they've come into contact with. Also normalization. It's very important to let the youth know that they're not alone and they can recover. Also, there's a lot of, as being somebody in recovery and seeing things happen, I feel like children tend to get lost in the mix. And there's also some other programs as well, but being able to let the children know that, first of all, the addiction that maybe their parents have is not their fault. Letting them know the things that happened during their childhood is not their fault can also go a long way, because they do feel, maybe it's something that I did, and there's a lot of guilt there. And, letting them know that they are not the ones who started the whole thing, it can go a very long way in helping them to recover maybe from, the trauma that they've experienced, because a lot of youth do experience trauma, especially in families that have experienced addiction. And then the last one is relationship building. Obviously, as a youth peer supporter, you can actually talk to the youth to help them to build other relationships, because a lot of the youth do struggle with that only because they weren't taught that in early childhood on how to actually build a meaningful relationship. And I think that can go a long way as well. Before we move to the next slide, I just wanted to talk about, there's a few other programs for especially children who have went through, maybe their parents going through addiction, or maybe even themselves. There's a program that's offered by Hazelden and Betty Ford. Unfortunately, it's only in 2 states right now, but I wanted to kind of touch base on it. It's a children's program, basically where they get a whole bunch of children whose parents are either struggling now with addiction or are in early recovery. And they basically just allow them to express themselves. They get them all together. There's a lot of very highly trained, skilled counselors. It's a multi-day program where they do teach, children, again, which I've already discussed, but there's a few things that I want to touch base on. They teach them, first of all, that addiction is not a disease. Also, that addiction is not their fault or their responsibility. also that they're not alone, and there's healthy ways to cope with the pain and difficulties caused by their parents' substance use. So I think that's also very important as well. Next slide, please. And then last but not least, I kind of wanted to touch base on basically what we believe as peer recovery supporters and what it states in our code of ethics. Peer recovery supporters must believe that there are multiple pathways to recovery, and I just wanted to put a few different examples of the recovery pathways. There can be various 12-step community programs, including Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Crystal Meth Anonymous, and Celebrate Recovery, which is more of a faith-based program. There's also medication-assisted treatment programs or medication for opioid use disorder programs that people go through as well. There's also natural recovery. Some people are able to recover without, any additional support, and they're able to just get sober, stay sober, and that's all they need. There's also holistic approaches. Some people believe in yoga. Some people believe in healing stones. There's all totally different ways of having some type of recovery pathway. Last but not least, something that I really and wholeheartedly believe in is harm reduction. Some people who are struggling to find or stay on the path of recovery may have some chronic relapses. They may struggle very hard. The whole point of harm reduction is to provide support, make sure the person who may be struggling, if they are using, make sure that you give them access to resources that will help them to use safely. And I tell people a lot, harm reduction also involves basically loving the person until they're able to love themselves and get on the path of recovery. That may take months, that may take days, that could take years. But as long as you're there and show them that you care, it can go a long way as well. I always like to tell people there's a few different ways to kind of discuss harm reduction in everyday life. Harm reduction can also be like seatbelts, wearing seatbelts when you're driving a car. Harm reduction can be using an inhaler for your asthma. Harm reduction can be using insulin for your diabetes. So there's different ways that harm reduction can be incorporated in everyday life that we may not even realize. But I just kind of wanted to touch base on that, and I guess that's all for the presentation. Again, I want to thank everybody for allowing me to speak, and thank you again, Dr. Kaufman.
I just want to say one last thing. I love that harm reduction statement. I just actually sent you a message about that, and I'm going to co-op that. That's fantastic. And I want to give Evan props. I know you guys need to go in your small groups and do cases, but Evan, when he was with OSU, we've been distributing Narcan as an example of harm reduction, right? We've been doing that at OSU since 2015. But it was Evan's brilliant idea. He said, "Hey, Dr. Kaufman, I really think we should start doing this thing called fentanyl test strips. Like, I think there's a lot of dangerous stuff on the street. There are people, they think they're getting stimulants, but then there's this admixed fentanyl in there. We've got a lot of people overdosing. We've got a lot of people dying. I think we really should start doing this in the emergency room." And I was like, man, that sounds like a great idea. Let's do it. So we have been doing fentanyl test strips, and we're actually the only emergency room in Franklin County doing that since about 2019 because of Evan. And I'm hoping to get into like safe syringe supplies. I'd love to do syringes too, but maybe a bigger ask. But those are all because of Evan. So I can't say it enough. Harm reduction is the way to go. So thanks, Evan, so much.
Thanks so much.
Mm-hmm.
And thank you both. This was so informative. And I think Dr. Kaufman kind of setting the stage with how intense this problem is for Ohioans. And I just have personally goosebumps knowing that Evan has made such a difference for himself, for his family, and for the state of Ohio. So thank you so much for being here. I've learned a lot this morning, and I know that there's some chat been going on specifically around the START program. How, Evan or Dr. Kaufman, how might we know if the START program has expanded to our county across Ohio?
So you can go to ohiostart.org. They are in 52 counties right now across Ohio. There is certain places that you can go, and to be honest, it's not the most user-friendly site. But if you go to the different resource tab on there, there's some frequently asked questions, and also it kind of goes into detail about who would be, I guess, approved to work on the START program and be, a family that's participating. But there's different tabs here. And under that, there's just a contact us, there's services, staff, and then impact. I'm not 100% sure where to locate like the map of where the services are, but I do think it's super beneficial to kind of read through that because if it's not in your county, maybe see if you could possibly be an advocate to get it started in your county because, I think it's super helpful and very supportive to families who are either struggling with addiction or children who have experienced that.
Excellent. Thank you so much. Yeah, and we will also, as the part of the SCOPE team, look for those resources and share those out in the follow-up email. We also have a question, and now's the time. So if you have questions, don't hesitate to unmute or put in the chat box. But Kristen asks, you spoke about helping youth build relationships. What kinds of things do you do to teach this?
So obviously, being able to, when youth is with you and you are providing this support to them, showing how you interact with others on a community basis in relationships can go a long way because they can sit there, they can kind of pay attention to what's happening, how the interactions are going, and they can learn from that. Obviously, you can also have some one-on-one time, talk to them about how they can build relationships, the right things to say. Some youth may have, a problem with cussing a lot, letting them know kind of what's proper when you are having a discussion, when you are trying to build a relationship with someone. There's a lot of different ways I feel like that you can do that, but I feel like, having the youth with you while you're talking to others can go a long way because they can learn a lot from that. Obviously letting them know because, some people may have wandering minds saying, hey, I just want you to kind of pay attention to how I'm interacting with this person before we talk. And then you can kind of let me know, ask questions afterward if you have any so that I can best help you any way I can. So.
Excellent. Thank you, Evan. And we also have Kathy put in the chat box that Cincinnati has a Glad House organization for children 5 to 12 years old with parents with substance use disorder. Wonderful information you shared with us today. Again, we are so happy to have you join our team as individuals that come together for this Project Scope. We are focused on children, but we can't do work with children without the adults in their lives. And so we're so happy to have you guys talk about the peer support and the youth support models that are really taking hold of across all of our communities. And we need them. And we need folks like you all over, Evan. So thank you so much for being here with us. Go ahead.
Thank you again for having us. And I wanted to just let everybody know if you do have any additional questions or anything like that, I did put my email in the chat box. It's my work email. Feel free to email me if you do have any questions, and I'm more than happy to answer them. So thank you.
Wonderful. Thank you. And keep up the great work you guys are doing in Franklin County and spread that. Well, I hope you all had really great discussions. I think at this point we've saved a bit of time because we heard from you that you wanted more time to learn from each other in the big group as well. So we will go forward with having some report outs and some conversation around, let's start with how we can support the mother and baby bonding. And I'm going to tap Sue. Sue Meeks, do you want to share out first what your group came up with?
I would. This was a great group, and they had lots of really, really good ideas. So I'm not going to go through all of them because I'm sure they'll be repeated from other groups. But one question that came up was, did this mom have children that she had bonded to before? So was she familiar with the bonding process, and maybe to talk a little bit about that and see if she had a positive bonding. The other one was to do some mothering education and some bonding, like infant massage, or have the mom, if it felt comfortable to her, do some kind of hands-on things. But the biggest one was building a relationship with this mom, meeting her where she was. And I heard you talking when we first came back about catching her doing good mothering and bonding, and then finding something positive in every meeting that she was doing. So that was a big one that the group seemed to think was the most important, to give her confidence that her parenting, was going to be okay and that bonding was taking place. So I think those were the three biggest ones for us.
Yeah, thanks, Sue. And team, yeah, I think it's very important to not lead anyone to feel like they have to be perfect right out of the gate. As a new mom myself with an almost 8-month-old, it's a learning curve. So, yeah. Great. How about Amber in your group? You weren't with Sue, correct? Okay, we'll come off mute and share what your group came up with.
So I don't want to brag, but we are the superstar group, so we had a great conversation about trying to think of some things to help this mom. We talked about visitation. So trying to have as much visitation as we can. There was a group member who works for Children's Services, and they said that they can go up to 3 visits a week for 2 hours or more. And it can even be more times if mom is open to it. So increasing frequency, encouraging skin-to-skin contact, being on the floor with the baby, talking to the baby as much as possible. Another group member mentioned to make sure that mom is present during the visits, making sure that there are no distractions, her being able to take pictures with the baby, and actually maybe taking the pictures and putting them in the book, so that at nighttime or during the day, the foster parent can go ahead and go through the book and say, here's mommy, and talk about that. And also making sure that mom is invited to medical appointments. Now that telehealth is an option, she can go in person or she can have telehealth appointments so that she knows everything that's going on with the baby. And then at some point, maybe having some sort of therapy with the child when she has her own therapy to kind of go through her trauma. So those are the things that we talked about during our group.
I love it. Yeah, that was a rockstar group. Thank you, Amber. Next, we'll go to Aaliyah.
Our group talked a lot about the different resources that are available to not only caregivers, but also children that have experienced their caregivers having this type of situation. So that's something that we talked a lot about. I don't know if anyone else from the group wants to chime in on specific things that we'd mentioned that was available. I know there was a few different types of AA programs for different individuals, and that was something I had not, I just learned about today, so.
Yeah, so we talked about maybe having, if the treatment center that she's in, having her partake in some type of parenting class or mother class of some sort to kind of teach her how to do certain things and how to build that bond with her child. We also talked about her building some sort of social support once she gets out and the resources and things like that. So she has, other people to lean on whenever she graduates from treatment. We also talked about maybe, if they're able to visit the facility with the child, to allow that to happen, to slowly start that bond. And then really linking her with peer support once she does get out to help her complete this intensive case plan, which sounds very intimidating, and would be intimidating if you are going about it by yourself. So those are some of the things that we had touched on in our group.
Wonderful. And as you were talking, I was also thinking there's likely some really fantastic online trainings as a result of everything moving virtual during COVID. Mm-hmm. And I know I did the Kettering Health Network out of the greater Dayton area. They had an amazing online set of modules for mommy, mother preparation, father preparation. So I don't know if we could add that to our list too, but if anybody has others just, online that somebody could do on their own. please put those in the chat box or share with your facilitator. Next, let's move to Kathy Weddig. Talked about what your group came up with.
Well, we were still looking for some answers, and I asked you what type of programs the residential situation might have for children, and if there's not, good programs about educating that residential program to the real need for moms and babies to interact. That there should not be a barrier to that either which way. Sometimes I've seen where the maternal therapists think that working too hard with the baby is interfering with mom's therapy, because she's not directed to just what a single woman therapy would be. So working with the residential center to have them understand more why it's necessary for this mom to parent. So that was, we basically discussed that, and then all these other things. Sarah from Lucas County was talking about their Healthy Baby Court that works to wrap around all kinds of services so that mom's parenting can be determined by even within the first year, as opposed to waiting for a long period of time to reunite mom and baby.
Excellent. Such rich information around Ohio, and there is pockets of programs here and there. And so it's so great to be able to come together and learn what's available and how we could maybe expand that across all 88 counties. So thank you for your group. How about Elsie, your team?
Yeah, so our team also kind of discussed ways that we can do like parenting support skills, and as well as just like general ways to facilitate attachment. But one discussion we did have was just really trying to support a strong relationship and positive relationship between, that's my dog, I'm sorry, between the mom and the foster parents, to see if there's a way to kind of facilitate that relationship. And part of that could be that education to foster parents on the things that we learned about today about peer support, addiction, to kind of really help be an extra partner in that team for that mother.
Yeah, that's a great addition to our list of suggestions. Thank you. It looks like Michelle or Kristen, you might be up next.
Michelle, I can read them since I have them on my screen. We're still talking about bonding, correct? Okay.
Yeah, we've gone a little bit back and forth, but yeah. Feel free to start finding it. Yeah.
Okay, well, about as far as after she gets consistent access to her child and to help her with bonding, we also talked about infant massage and parent mentoring program, which I think has been mentioned already. We also talked about helping mom to identify role models in her own life so that she could kind of a modeling thing, remind her that what good parenting actually looks like. We also talked about some play-based strategies and recognizing, teaching mom to recognize communication cues with her child, and teaching mom how to interact with her child in really simple ways, like tummy time, getting down with the child on the floor and playing, making faces, this kind of thing. And also in doing that, to assess her mom's understanding of the child behaviors. So kind of like making sure she understands developmental milestones and what the child should be doing and how to help her achieve those milestones, kind of help me grow. That's kind of one of our other strategies, but yeah.
Great, I love it. And the idea kind of came through for me in listening, is making sure that mom understands that even if the child doesn't want to, sit on lap or be cuddled, that to not take that personally, and to really continue to work and not to get discouraged.
Right.
Yeah. Thank you guys. How about Troy? Your group.
Yeah, we talked a little bit about doing some eco mapping and just kind of helping identify what supports do exist, with the mom it was saying there was identified little social support. So identifying what is there, and then helping map through what are some of the resources out there that we can connect to and create a plan. We talked a little bit about helping prep the other people in the child's life in terms of caregivers that are taking care of the child, doing a social story with the child, letting them kind of get to know and learn about mom, so it's not this sudden thing that she just shows up and it's this new person that the child doesn't know. I mean, just with all of the virtual options available, what are some videos, video chatting, pictures, things that we can do to connect mom and the child if physical contact isn't available right now. Talked a little bit about helping educate the medical professionals in the parent's life. So just, from the time they walk in to the hospital to give birth, there's a lot of, judgment and explicit bias that happen in those hospitals, and that really discourage those parents from the start, where they feel like from the beginning they aren't equipped to do this. So helping educate those people surrounding that adult, and then also helping her create a plan of, okay, if you're not with her right now, what will you do when you're together? And not just talking about treatment and addiction, but what would you like to go to the zoo? What toys do you want to play with? Like, what are some fun things that you can kind of create a plan of when you do see your child again? What can you do together in creating a happy, excited times moving forward? Because it can get heavy on the treatment focus of just that you miss out on all the fun stuff too, and that stuff is important to look forward to for parents.
Excellent. Wow, we've had such great ideas. Other participants want to chime in and add to anything we maybe didn't cover in our report back?
I wanted to add,
go ahead,
we kind
Amber.
of talked about making sure that mom's trauma is addressed, making sure that she is also getting services, some therapy, along with her sobriety treatment. We think that's very, very important, and also linking her with peer support. And if, and community supports, building community support just to help mom. So that's another thing.
Awesome. Thanks for moving us into how do we support mom's long-term recovery. Perfect. Let's see. Joe and Aaliyah, any other specifics from your group on long-term recovery and support for mom?
I mean, we covered about her, like when she leaves treatment. We did mention like counseling, peer support, community support, any other things that are in her area that she can get herself familiar with. Maybe asking this DCBS, like if there's other mothers who have similar cases, if they would be open to being supportive and communicating with her. We mentioned like her like writing letters to her child, things like that to, let them kind of, have them to read when they're older, or she can read them to them, or things like that. Just getting linked up with any type of community resource is available for her. She needs to partake in because social support is the biggest aspect of anyone's recovery. We can take medication all day or whatever, but if we don't have someone to talk to or to lean on or to know that we're not alone, then it's not sustainable.
All about connection. We haven't learned anything coming out of the pandemic. It's that we missed being connected, right?
Yeah. We're human, and I mean we strive on that, feeling like we, belong in that, social interaction and speaking to one another and meeting and seeing and touching. And so I mean our brain thrives on that kind of stuff. So
That's another.
Go ahead, Sue. Yeah, thanks, Sue.
That someone brought up in our group was that, once she has baby back, and there may be multiple appointments because of, because it was a premature baby and the exposure. And that's another judgment when you walk into, the physical therapy office or the neurology office, that mom, I'm sure, here's judgment because this is what I did. But to have either a peer support person or a help me grow person go with them, at least initially for those visits, I think they would feel much more supported. And we found that people are treated differently when there's an audience than when there isn't. So I thought that was a really, really good idea that came from our group.
Yes, and I think that's a huge push in general in this work is how do we break down some of that implicit bias that was talked about, explicit as well as implicit. But there is also that just very overt bias that we see in systems in healthcare. So thank you for bringing us back to that. I know there's more wonderful ideas out there, and I know Michelle also put a great evidence-based therapy for mom and baby as child-parent psychotherapy. And so thank you for putting that in the chat box. And the remaining couple minutes, if there are other ideas from anyone, please don't hesitate to use the chat box. Oh, and I'm sorry, Alicia also reiterated a bit of what Joe was talking about with writing letters, but also having mom read books in various ways and having those recorded so that baby can hear mom's voice. I think that's a really cool idea as well. So
Yeah, I like that.
Yeah. As we move to wrap up for today, again, thank you so much for your participation, coming off mute, showing us your amazing maskless face on camera. And thank you to Dr. Kaufman and Evan for supporting us in this topic and teaching us all something new. Thank you, Emily, for putting your email address in there. And then as we think through it, in 2 weeks, we're already going to be into July. Whoa. So make sure that you have a very safe and happy and fun Independence Day, as well as don't forget that we are always looking for cases. Obviously, we had a really rich discussion today with just a small snapshot. It doesn't take much. We have the form that you can complete, and then we will put the information into slides for you. We'll even go through the case for you if you want, but we would just like to hear directly from you in our community on how we can help families, children, moms, foster parents, adoptive parents, anybody. So we're always looking for cases. And again, as a reminder from 2 weeks ago, there'll be a prize because everyone loves a good prize for sharing a case with us. So thank you again. I'll be looking for your email with your evaluations, and please complete those. Again, they're very important and we review them as soon as they're completed. So thank you to all of our hub team and our participants today, and have a great weekend.